Welcome to Penrose Learning, where we make understanding easy.
In this video, I will explain how to do case studies in NCLEX. First, familiarize yourself with the structure of these case studies, which often present a patient scenario followed by multiple questions. Focus on extracting critical data, such as vital signs, lab results, and patient history, to form a complete picture. Then, apply your clinical judgment to prioritize interventions and identify potential risks, just like in real-world nursing. When approaching an NCLEX case study, begin by thoroughly reading the entire scenario to grasp all details. Pay close attention to the patient's medical history, current symptoms, and any reported changes in their condition. Next, carefully evaluate all provided diagnostic test results and the patient's current medication list. This comprehensive review helps you connect the dots and understand the full clinical picture. After analyzing the scenario, the next step is to formulate a robust care plan. Start by identifying the most critical nursing diagnoses based on the patient's presentation. Then, determine the most appropriate and effective interventions, considering both immediate and long-term needs. Always anticipate potential complications and predict the likely outcomes of your chosen actions, ensuring a holistic approach to patient care. Finally, when answering the case study questions, always select the best option supported by the evidence presented in the scenario. Take a moment to review your choices, ensuring they align with sound clinical reasoning and patient safety principles. Remember, practice is key to mastering these case studies. Also, be sure to check the description for a link to some great socks and other deals that might interest you. Good luck with your NCLEX preparation.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.